Hello, everyone. Thank you so much for joining. My name's Heather Gagliano. I'm with the Idaho Immunization Coalition. I'm so excited today to have two wonderful speakers to come here and share their story. We have Patti Wukovits, who's a nurse. Patti is a registered nurse and leading advocate for meningitis prevention, serving as co-executive director for the American Society for Meningitis Prevention and director of the Kimberly Coffee Foundation. After losing her 17-year-old daughter, Kimberly, to meningitis B in 2012, Patti formed the foundation in her daughter's name to improve awareness of meningococcal meningitis and the vaccines available to help prevent it. Through her foundation, and most recently through the American Society for Meningitis Prevention, she has educated thousands of healthcare providers, policymakers, school administrators, and students around the world and led critical policy changes, including the passing of New York State's meningococcal meningitis vaccine law in 2016. Patti also currently serves as the Policy and Advocacy Committee of the New York State Public Health Association. She holds a Bachelor's of Science degree in nursing from Chamberlain University. We also have Alicia Stillman. Alicia is a passionate advocate for meningitis prevention, serving as co-executive director of the American Society for Meningitis Prevention and director of the Emily Stillman Foundation. Following the loss of her 19-year-old daughter, Emily, to meningitis B in 2013, Alicia transformed her grief into action, sharing her story with thousands of healthcare providers, parents, and young adults across the United States. Over the past decade, she has worked to empower communities to take action to prevent meningococcal meningitis through education, policy, and vaccine equity initiatives, and by mobilizing a national network of advocates. She currently serves in the World Health Organization Task Force to defeat meningitis by 2030. In addition to her advocacy work, Alicia is the chief financial officer of a multi-state law firm based in Michigan. She holds a Bachelor's of Science degree from Arizona State University, a Master's of Business Administration from Wayne State University, and a Master's of Public Health from George Washington University. We are so excited to have Alicia and Patti here to share their story. The questions and answer, if you have any questions that come up, please ask them in the questions and answer section. And you're welcome to feel free to use the chat. So thank you, Alicia and Patti.
Thank you for inviting us here, Heather. We're very proud to present to your group. I am Alicia Stillman, and we are going to be presenting to you today, Protecting Idaho from Meningitis, Why It Matters, and How You Can Help. I started this work in 2013 when I lost my middle daughter to meningococcal disease. I didn't even know at that time how to say meningococcal, let alone spell it. I don't even know if I had ever heard the term. I knew that what bacterial meningitis was, but I never thought it would affect me like this. Emily was my middle daughter, and she attended a small liberal arts college in Michigan. She was a dual major, drama, where she loved comedy. She wanted to be on Saturday Night Live. It's funny because now they're having the 50th anniversary of Saturday Night Live, and she probably could be there. But also, because we told her she had to have a plan B, she was psychology. Emily called home one night in 2013 with a headache. I thought perhaps she was coming down with the flu. She thought maybe she was overtired because she had been up all night studying for several large exams. We decided she would take some Motrin and we would talk in the morning. That was the last time I ever talked to my daughter. She went to sleep. She woke up a few hours later, which really was only about 10:15, and she said to her suite mates, "My head really hurts. Perhaps I should go to the hospital." And they took her to the hospital. But the thing is, she walked into the hospital. She walked in with her backpack, an iPad, a textbook. She wasn't going to die. She was going because she had a headache, and she was worried about the headache, but she had no idea how sick she was. They started to, because she simply presented with a headache, they treated her for a migraine. There was nothing else present that would indicate anything else. They did a wonderful job taking care of her. But as the late night turned into early morning, she began to get confused and sicker and even a little combative. And that's when they began to suspect that maybe more was going on. They tested her for meningitis at that point, and protocol is they started an antibiotic drip. But Emily lost consciousness. And by the time I was called the next morning, Emily was 19. So by the time I was called the next morning, she was already in a coma. They were preparing her for a craniotomy. They told me that I should get to the hospital right away. When I drove to the hospital, I made several phone calls. I remember calling her pediatrician because they told me she was very sick. She had been diagnosed during the night with bacterial meningitis. And I was very confused because to me, I remembered Emily had been vaccinated with bacterial meningitis because her year was the year that the recommendation changed to add the second dose of the MenACWY vaccine. So it was fresh in my mind where it's not like I would have remembered when she was 11 what vaccines she had had. By the time I got, and they told me, the pediatrician's office told me she had every vaccine that was recommended at that time. When I got to the hospital, they were preparing her for a craniotomy. They told me that the swelling in her brain was so severe from this bacteria that she would be so, if she were to survive, that her brain damage would be so severe. And in order to lessen that and give her brain room to expand, they were going to do this craniotomy. They asked me if they should call clergy. I remember that so well because I think that was the point where I called my husband, who was out of town on business, and said, oh my God, this is so not what I thought was going to happen when I got here. You better get home right away. And he started his reservations to come home. Emily survived the surgery, this craniotomy, but she never regained consciousness. And they told me that probably the swelling was so severe in her brain from the time she originally lost consciousness that probably she was brain dead at that point. And by the next morning, they confirmed she was brain dead. Those are words you just so never expect to hear about your healthy 19-year-old daughter. It has happened so fast. I didn't even understand what was happening. I know that we made the decision during that period to allow Emily to become a hero. Emily's meningococcal disease stayed in her brain and in her spinal cord. It never entered her bloodstream and transferred anywhere else. So for Emily, her organs were still healthy, and she was able to donate 6 organs to 5 people. She was a hero. When I said goodbye to my Emily on a very, very cold February morning, she had tubes coming out of every part of her body. And I said, you go at peace. I'll figure this out. I mean, I still did not understand what was happening. I said, I'll figure this out, and I will make sure that this doesn't happen in other families. And I left her there. Several months later, I created the Emily Stillman Foundation and started my work. I learned that the vaccines that I thought was protecting my daughter, protected her against serogroups A, C, W, and Y. But that a vaccine to protect her against serogroup B was not yet licensed in the United States. I knew that I needed to do something. I did this work for a while by myself. And shortly thereafter, I met my partner, Patti. Patti's going to share with you her beautiful Kimberly story. And we were doing very similar work in each of our parts of the country. And we decided to combine our work, and we created the Meningitis B Action Project in 2017. And we worked with that for several years until we knew that we needed to be even more comprehensive than that. And last year, we launched the American Society for Meningitis Prevention. Our work is recognized all over the country. Our resources are used throughout medical centers, cities' offices, state offices, college systems, all over the country where they want unbranded material. We speak to audiences of all size and all ages about the importance of vaccination against this disease. And we'll be telling you more about that. Patti?
Hi, everyone. I'm Patti Wukovits. I'm from New York. As you know, registered nurse. My background, most of my career has been in oncology, specifically GYN oncology, and most recently in family medicine. So I've been able to do a lot of vaccinating, which has been very, very fulfilling for me. So I'll share with you my daughter, Kim's story. This is her across her lifespan, her short lifespan. Unfortunately, she was just 6 weeks short of turning 18 when she died from meningitis B. Kim was my youngest of 2 children. She was a really funny kid. She was like so full of life. When you met her, you couldn't help but laugh. She just entertained everyone. She was just a great kid, right? Who doesn't say that about their kid, but she was really, really a great person. Kim's dream was to be a pediatric nurse. And I remember like, wow, what kid knows what they want to do at 17 years old? So I was so proud of her. She wanted to follow in my footsteps, but she wanted to go into pediatrics and she wanted to make a difference. She wanted to save children's lives. And I was really super proud of her. When Kim was in her last week of high school in June of 2012, she texted me while I was at work. She came home from school. She texted me while I was at work and she said, "Mom, I have like my body hurts, like I have these body aches, and I took my temperature, it's 101 rather. She said, but I just took some ibuprofen. I'm starting to feel a little bit better, but please come home soon." So I got home as soon as I could. And she was actually fine. She was her usual self. Kim loved to sing. She loved to dance. She was doing all of that. She wasn't sick. She just had some body aches and a fever, and she was better now. She insisted, though, that I call the pediatrician, so I did. And he said, the flu-like symptoms could be just that. Check in with me in the morning, keep an eye on her. So we went to bed that night. Like I said, everything was fine. We woke up the next morning and I actually slept in her bed with her that night, which is not something I would typically have done. We wake up the next morning and she says, "Mommy, I'm so sick." I mean, she could not lift her head off the pillow when I tell you. She said, "Every single thing hurts me, Mommy, from the top of my head to the bottom of my toes. There's really something wrong with me. I need you to take me to the emergency room." And I just was like, wow, what is going on here? What changes just happened overnight? And then she said to me, "I feel like my ankles are bleeding." I looked at her ankles and she had petechiae on her ankles, really tiny. Like I want to say like maybe 3 to 5 petechiae on her ankles. And within minutes, I saw the petechiae increase in number, and actually a purplish rash began to go right up her legs. I later learned, of course, that because she had the bacteria, meningococcal bacteria, infected her blood, that her capillaries were actually leaking. And this is the sensation that she was feeling, that her ankles were bleeding. So I quickly took Kim to the hospital. Once I got there, they put her in isolation real quickly. They started IV, they drew blood cultures, then started IV antibiotics. And I mean, there were so many people in this room. It was so overwhelming. It felt like, to me, it felt like 100 doctors. There was probably 10. A lot of ER people, and just asking Kim a lot of questions. Where had you been? Who were you with the last few days? And she was able to answer those questions, although she was very, very uncomfortable. She explained she had been at a party the past weekend. This was her symptoms started on a Wednesday. This is now very early on a Thursday morning. And she said, I was at a concert on Sunday. I took a train from Long Island into Manhattan. I went to an outdoor concert, took the train back. And I was also at my friend's party, an outdoor party as well. So of course now, all the contact tracing goes into effect. So right before our eyes, she complained that her back was hurting her. And we looked at her back, pulled up the gown she was in, and saw this purplish rash literally just go right up her back. It was incredible. She turned purple. It was just like something I've never, ever seen. And they gave her some morphine, got her comfortable, and rushed her up to the PICU because, like I said, she was still 17. I was thankful that she went into the PICU. She got even more personalized attention. And they took such great care of her. I have not one thing to say. I mean, they did everything they should have done for her. The doctor pulled me aside and she said that we suspect your daughter has bacterial meningitis. And I said, well, it can't be possible. My daughter was vaccinated with the meningitis vaccine. It must be something else. And she explained to me that the vaccine that Kimberly received only protected her against 4 of the 5 serotypes of meningococcal meningitis. It only protected her against serogroups A, C, W, and Y, and didn't protect her against serogroup B, which is what we suspect she has, which is also known as meningitis B. I mean, I was just like, what is even happening? I hear what you're saying, but how can my daughter have meningitis when she was vaccinated? None of this made any sense to me. And things happened really, really quickly. She was in multi-organ failure. She never urinated from before we left the house. Her heart and her kidneys and her lungs were failing. She was in shock and in septic shock. It was quite a mess. And all of the specialties were called in. And they were telling me, though, that she's strong, she's going to pull through. This is not something obviously we see often, but we know how to treat it. They were on the phone with all different places all across the country. And they were doing the right thing. I was very confident with where she was. But as the days went on, Kim, because she was in shock, and because the bacteria had infected her blood, she was losing blood flow to her extremities, which initially were bright purple and then became black. And they explained to me that although Kim still has very significant brain activity, if she does survive this, she will likely be a quadruple amputee. So that was a lot to absorb. But my husband and I, of course, were just so thankful. If she is able to survive this, we'll get her through. So another 2 days go by, and then the scans revealed she also wasn't, at that point, not getting blood flow to her brain. And she had impending brain herniation, and we had to make a decision whether or not to remove her from life support. I had to get my son in from Oklahoma. He was in basic training with the Army, so he had to come in. I had been in touch with him every day throughout. He had to come home, and then we removed my otherwise perfectly healthy 17-year-old from life support. It's not something any parent should ever have to do, let alone what my daughter went through. It was a horrific death. She was hemorrhaging. It was horrible, absolutely horrible. So we took off the life support and we turned off the life support rather, and we buried Kim in her prom dress. Her prom was coming up the next week. She had her prom dress hanging on her closet door. Beautiful. It was gold and little shoes right there all ready to be danced in. So I buried her in her prom dress 2 days before her prom and 3 days before her graduation. And I knew I had to do something. I mean, how could I, as a nurse, let alone a mom, but how could I, as a nurse, not know about meningitis B? How could I not know that my child wasn't fully protected against meningococcal meningitis? How many other parents didn't know this? And that's why I created the Kimberly Coffee Foundation. And as Alicia mentioned, we were doing very similar work, and then we joined forces. Through the Kimberly Coffee Foundation, one of the things that I also do in addition to education is, because Kim wanted to be a pediatric nurse, I offer nursing scholarships to New York State high school seniors who are pursuing a nursing education. So her name does live on in that way as well. So we've given out many scholarships over the past 12 years now. Next slide, please. So we were formerly the Meningitis B Action Project. These are our two girls. Our work is inspired by our two beautiful daughters. And Alicia and I, like, even though, we didn't know each other, of course, I live in New York, she was in Michigan. Now that we're together, she found me on the internet. That's another story. But we like to envision our girls as sitting on like a little rock ledge with their feet dangling and saying, would you look at what our mothers are doing now? What are they wearing? Oh my God, what are they saying? Look at these two. And so that kind of gets us through every now and again. We like to envision that. So our key areas of focus through the American Society for Meningitis Prevention, also known as ASMP, parent and patient education, healthcare provider education, because a lot of healthcare providers don't know about the 5 different serotypes, and the fact that, I shouldn't say they don't know about the 5 different serotypes, they're not aware that there are different vaccines to fully protect against meningococcal disease. We work on policy advancement, vaccination equity is big, and advocacy training. So an overview of meningitis and the prevention landscape. So meningococcal meningitis, again, it's a bacterial infection. It's the most common form of bacterial meningitis in adolescents and young adults. The most common age group is 16 to 23. It is mainly caused by 5 types or serogroups of meningococcal bacteria, A, B, C, W, and Y. The 2 most common types of meningococcal infections, the 2 most common ways that this disease presents is meningococcemia, which is a bloodstream infection that may lead to sepsis. That's Kim's story. Or meningitis, an infection of the membranes that surround the brain and spinal cord, and that's Emily's story. And this is a diagram depicting how both of these ways can be manifested. It's really important to know that this disease can kill within 24 hours. For Kim, it was 8 or 9 days. For Emily, from her first symptoms, I believe, Alicia, it's 36 hours. So really, really fast. So it is easy to spread from person to person. It can attack without warning in healthy individuals. It can kill in a matter of hours. 1 in 10 who contract meningococcal meningitis will die from this disease, and 1 in 5 will face permanent complications, lifelong complications, limb loss or brain damage, hearing loss. There's so many different ways that you can have the lifelong effects of this disease if you're, quote unquote, lucky enough to survive this horrible, horrible disease. And the symptoms are And you can have any of these combination or just one. You know, high fever, a stiff neck, headache, the worst headache you've ever had in your life, extreme exhaustion, nausea and vomiting, a purplish rash if it has infected your bloodstream. And it's transmitted, so, you know, through the exchange of saliva. And we know that that age group, 16 to 23 years old, are at increased risk. One of the reasons why is because they share a lot of saliva. You know, whether it's being in close quarters, being sneezed or coughed upon, kissing, sharing e-cigs and vapes, sharing drinks, sharing food. We know that this group does lots of saliva sharing. So there are 3 types of vaccines currently available in the US to protect against meningococcal meningitis. We have the MenACWY vaccine, which has a routine recommendation. Many high schools and colleges require it. Not all, but many require it. Then we have a separate MenB vaccine, and that decision, that recommendation from the ACIP is shared clinical decision-making recommendation. Few colleges and universities require that. And that is a shared clinical decision-making, just as a reminder, is a discussion that has to happen between the provider and the patient or the parent. If that discussion doesn't happen, they have nothing they can actually make a decision about. And now the newest tool in the toolbox is the pentavalent vaccine, which is the MenABCWY vaccine, and that's used when you would be giving the MenACWY vaccine and the MenB vaccine at the same visit. So typically the 16-year-old visit, and I'll get into that on the next slide. So when meningitis vaccination should occur, 11 to 12 years old is currently when it's a routine recommendation to get the MenACWY vaccine. And then at 16 years old, it's recommended to get the MenACWY booster dose. And at that time, you can get a MenB vaccine. MenB vaccination is recommended between the ages of 16 to 23, preferred age of 16 to 18. So at 16, you have a choice. You can either do 2 separate vaccines, one MenACWY booster and plus a separate MenB vaccine, or you can give the pentavalent vaccine, which has all 5 serogroups in one vaccine. 6 months later, it is required that you have to get a separate MenB vaccine. So it's a bit confusing. There's 3 different vaccines, when to give them, at what age, which one do you give? It's confusing. So we do our best that we can through our educational materials to explain that and really map it out well. So there are very many critical issues that are affecting meningitis vaccination. The uptake of the MenB vaccine is unfortunately much lower than that of the MenACWY vaccine. Recommendations for the pentavalent vaccine are very difficult to implement in practice, which I just was alluding to, that you're going to have to stock 3 different vaccines in your refrigerator, in addition to all your other vaccines. There's so much room for error. Like right off the bat, that is the biggest thing that I see. Who's pulling out these vaccines? When are you giving it? Are you giving the right one to the right age group? There's just way too much room for error to have 3 different vaccines going on. I mean, we're thankful that they are there, but the recommendations have to be clearer. Cases of meningococcal meningitis are rising with new levels of unpredictability. Meningitis vaccination coverage rates vary by poverty status, race and ethnicity, and health insurance status. That's a big problem. The ACIP is expected to revisit meningococcal meningitis vaccine recommendations this year. However, we're not sure how that's going to play out now, if the meetings are actually going to take place or not, and if so, when. So some doctors are not talking to the patients about MenB vaccination. And, you know, the ACIP, the CDC recommendation is to have a shared clinical decision-making, recommendation. So unless that conversation is not happening, parents don't know what to make a decision about. And according to a study published in the Journal of Pediatrics, among 900 doctors that were surveyed, 49% of pediatricians didn't discuss the MenB vaccine during routine visits for their 16 to 18 years old, and that's the time that it is recommended to give it. 69% of family physicians did not discuss the MenB vaccine during routine visits for their 16 to 18-year-olds. So we really, really have to do much, much better. I'm going to turn it over to Alicia for the rest.
So another issue that we found is that very few schools require the MenB vaccine. In the study that we conducted, when we wanted to know why are those stats so low, why are they not talking about it, we found that they do discuss it when a school requires it. If they are going to a college that requires that you have as the second dose of the MenACWY vaccine and the MenB vaccine, then they're bringing it up. And if a college doesn't require it, they don't bother to bring it up. But in those situations, the problem that we have with that is that the healthcare provider is actually making that decision for the patient and the parent. And that decision is supposed to be made shared between everybody. And when all of the statistics are presented to a parent, where these are the vaccines that are available. I'm going to give your son or daughter the ACWY vaccine, the second dose as required, but there now also is another vaccine, a MenB vaccine. And MenB is actually, which we will get into, very, very high occurrence compared to the other serogroups, and is responsible for all college outbreaks since 2011, Patty? 2011. And when it's presented in that way, what parent is going to say, no, thank you. I'm okay if my child is just partially protected. So this is really important to realize that it is really up to either the parent to go in armed with this knowledge to talk about it, or the healthcare provider to ask for it, or the school to require it. So in our work, we address all of the above. Next slide. This is, you'll find this on our website. And here is the statistic that I just referred to. 100% of college outbreaks since 2011 are caused by MenB, but only 40 colleges, 40 plus in that area, require the MenB vaccine. No high school requires it. So just so I make myself clear, when a parent or student gets all the intake forms for a college or university, and it says, whether it's just for informational purposes or the vaccines are actually mandated for the dorm, and it says this vaccine, this vaccine, this vaccine, and then it says meningitis vaccine. We work very hard on so many levels here because, number one, we want it to say meningitis ACWY, and then we want it to say meningitis B. We want to go further because we want it to say, what were the meningitis B vaccines, or was it a pentavalent vaccine? Because we know in the case of an outbreak, how important it is to know which vaccines that student had and when, in order to boost them up to their full immunity to protect them in the case of an outbreak. So that's what is so important about our work here. Next slide. Examples, these are specific examples from Idaho. No meningitis vaccine requirements, and a lack of clarity that a meningitis B vaccine even exists. So in so many situations, these parents are so much like Patti and I, where we thought our children were fully protected. Meningitis, check. We thought our kids were protected. We didn't even know that there was a separate vaccine. But there is now, since 2014 and 2015, a separate vaccine. And as Patti talked about, even a pentavalent vaccine. And we need to educate the schools and the parents. At the University of Idaho, strongly recommend immunizations, measles, mumps, and rubella, hepatitis B, and it just says meningococcal disease. Boise State, meningitis vaccine, at least 1 dose after age 16. Well, that's referring to the 2nd dose of the ACWY vaccine. We'd like it to specify and a Men-B series or pentavalent series. So that's our work. Next slide. The situation is better for the Men-ACWY vaccine, but not great. And by that, I mean the first dose of the ACWY vaccine, which is given at age 11, we know that children in that age group are going to the pediatrician each year, and they are getting, for the most part, those adolescent vaccinations still at that age. And though it's not perfect, it's the uptake on that vaccine is not horrible. But the ACWY vaccine, the uptake for the 2nd dose of that, the uptake drops significantly. It's 16. So we know at that age, they're not consistently going to the healthcare provider every year for well visits. They may go when they're sick and they don't want to give a vaccine. They may be going without a parent, so there's nobody pushing them to get a vaccine. So we know that it drops off significantly. However, the Men-B vaccine is even worse. The completed doses for that is even worse. So there's a lot of work. I guess that's the theory of, that's the summary of my part of the talk. There's a lot of work to be done. Next slide. In the United States, we are seeing currently an increase in meningococcal meningitis, mainly attributed to serogroup Y. And it's also mainly attributed to older individuals. In 2023, we saw the highest number of cases since 2013. The cases in this strain, like I said, were older individuals between 30 and 60. People with HIV were affected. Additionally, we are seeing antibiotic resistant strains, and that is really scary because those who do survive, that is how they're treated. We are also seeing it disproportionately affecting Hispanic individuals, and we don't know why. The access to meningitis vaccination varies. It varies by income, by race, and by location. We know these are some key statistics from a 2023 systematic review. Adolescents living in neighborhoods with median income over $100,000 were more likely to receive the Men-B vaccine compared to those in neighborhoods with a median income under $20,000. I believe that the reason is because of the healthcare that is available to them in those areas. The healthcare provider may be a private practice, take more time with the patient than going to a clinical setting. Hispanic parents were less likely to be aware of the meningococcal vaccines compared to non-Hispanic white parents. And rural counties and those with fewer healthcare providers had significantly lower stocking rates of the Men-B vaccines compared to the Men-ACWY vaccine. Next slide. The complexity in implementing the pentavalent meningococcal vaccination in clinical practice is what's worrying us about the new vaccine. We are so excited that eventually people can come in and just get the AMB-BC vaccine, but these are what we are facing now. Healthcare providers will need to stock 3 different vaccines if they want to use the new pentavalent meningococcal vaccine. They'll need to stock the conjugate vaccine, they'll need to stock a serogroup B vaccine, and they'll need to stock a pentavalent vaccine. And we're real worried about their ability and their willingness to do that and implement it correctly. So right now, well, in recent days, I should say, the ACIP committee, which is charged with making recommendations, all the vaccination recommendations, it is a group of the CDC. And right now they were in the process of looking at potential changes to the entire meningitis vaccination schedule. They're looking at whether they should change or keep the 11 to 12 dose, when that second dose of that vaccine should be given, because that immunity really only lasts 5 years. And then when should they get the B dose, and when should they sub in the pentavalent vaccine? They're talking about changing shared clinical decision-making to risk-based. That's, everything's up in the air. Work groups were talking about it, but we know now that the work groups have not yet had the opportunity to meet to prepare for the next meeting. So we're kind of in limbo right now, not knowing what is going to be the end of this month. So right now, in summary, the reality of meningococcal meningitis in the United States, 80% of the parents still don't know about the MenB vaccine. 70% of all meningococcal cases in the United States are among 16 to 23-year-olds are MenB. 100% of college outbreaks since 2011 are caused by MenB. We know that college students are 5 times more likely to contract MenB as compared to non-college students, but yet few colleges require the MenB vaccine or even identify the difference. We know that only 3 of 10 17-year-olds have received the first dose of the MenB vaccine. We know that only 6 out of 10 17-year-olds have received the second dose of the MenACWY vaccine. Patti?
So our goal is to educate and mobilize all of the stakeholders. We know that moving from knowledge to action truly does take a village. We have the parents. We have the students. These are all, everybody here needs to be educated. We need to provide the knowledge to them so that they can take the action to actually get vaccinated. So whether it's the parents, the students, your community, providers, of course, colleges and universities, advocacy organizations, policymakers, everyone needs to work together to actually make this happen. And the bottom line is to save lives. That's the bottom line, right? Educate, save lives. So how we can help you from the American Society for Meningitis Prevention. We have so many resources. They're also, in addition to being in English, they are translated into Spanish. And we've had really good uptake with our Spanish materials. So we have healthcare provider brochures, we have student brochures, we have parent brochures. Everyone speaks to the audience that it needs to. We speak at local meetings. We have many speaking engagements we do throughout the year, webinars such as this, and we are really eager to share our stories to help you spread this really, really important and life-saving message. We have posters. We have really great posters, and we designed them by speaking out and collaborating with adolescents and young adults. Tell us what resonates with you. So we really, our posters are very well received. We have videos, we have, which you're welcome, that they're on our website, you're welcome to download them. We have magnets that show the symptoms. We have magnets for the vaccine refrigerator that shows which vaccine is given at which age, so that we can hopefully alleviate some confusion. All of our information, all of our resources are downloadable on our website, meningitisprevention.org. Please, share our stories. Kim's story is about a high school student living at home. Emily's story is about a college student living in a dorm situation. So we run the gamut of the two. Both of our girls had the disease present in different ways, so that we can give you more of a you have more of a well-rounded idea of how this disease presents and to whom. So it doesn't matter if you're living at home. It doesn't, you're still at risk. You're still doing those risky behaviors of sharing saliva. Doesn't matter that you're living on a college dorm. Yes, we do know that college students living in a dorm are 5 times more likely to contract meningococcal meningitis than students that are not in college. But let's not forget those kids that don't go off to college, the ones that go to trade schools, the ones that don't go to work at all. All of those kids are still at risk. So 5 actions that you can take today to help prevent meningococcal meningitis. Integrate vaccine education campaigns. Combine our messaging and resources to promote comprehensive meningitis vaccination in any existing campaigns that you may already have. Educate your community. You're welcome to use our materials. Please reach out to us. We'll send them to you free of charge. All of our resources, it's important to know, are unbranded, and many providers and other clinics and colleges, universities are much more apt to use our resources, being that they're unbranded. Support vaccine administration. Partner with us for a meningitis vaccination clinic. We'd be more than happy to come in and help you work on a clinic. Know where to refer adolescents and young adults to get their meningitis vaccines. Help simplify meningitis vaccination. Advocate to simplify ACIP meningitis recommendations by submitting an oral or written comment before the next meeting, and those dates are to be determined based on what's happening currently. But we'd be more than happy to help you draft a comment, whether it be oral or written. Use our voices. As I mentioned, please share our stories. They're very impactful. Our daughters' lives mattered. All of your patients and children's lives, they all matter, and they're at risk. And by sharing our stories, it really does resonate. You show these 2 beautiful girls who then die from this very horrific disease. I mean, who doesn't understand that? But we know there's so much more than just telling the stories. We know there's the science behind the vaccines as well. Key takeaway: help protect your patients from meningococcal meningitis by making sure that young adults and adolescents are vaccinated against all 5 types of meningococcal bacteria, which are most likely to cause meningococcal meningitis, and that's A, B, C, W, and Y. And we are here to help you with anything that you need help with. And now we have some time, we can open it up to Q&A.
Thank you so much, you two, for sharing that really impactful your stories and the sharing us the lives of your daughters. I really appreciate that so much.
Thank you.
The vision of them sitting on the rock wall was just absolutely beautiful.
Yeah.
I made sure to have my tissues nearby when you were telling your stories.
I know.
I was curious, as people are able to type their questions in the Q&A section, if you can tell us a little bit about, you gave some really great action items. Have you seen or heard of anything that's kind of unique or new that people are doing in promoting this? I think about the Adolescent Vaccine Week is coming up April 7th through 11th, and is there anything that you've heard of that people are doing to really promote that the kids in our lives are being protected?
So, we've, through ASMP, we have advocates all across the country that work with us. everywhere. And even on Meningitis Prevention Day, which was when? October, was that Meningitis Prevention Day, Patty?
Yes.
We lit up stadiums, we lit up the Niagara Falls buildings with purple lights. So those, just to raise awareness. So many people haven't even heard of meningitis, and so many people don't know that it is meningococcal meningitis is a vaccine-preventable disease, but they just don't understand the different vaccinations that are available to them and how to utilize them. And that's it's education that's so important.
Yeah, and our advocates, so we recently held an advocacy training session, and we've been able to now mobilize these advocates and give them action to do. We have an advocate liaison that we recently hired who's really going to streamline that and make sure that, they're really doing as much as they possibly can. And it could be a little bit, it could be hanging a poster in their local pharmacy if they would allow that, but that's probably not a good example. Hanging a poster in their local school or something like that, to, speaking to their legislators. There's just so many things that they can do, and we do have a lot of ideas with them and a lot of things that we are giving them to do. And
I
they're
want to
so
point
excited.
out, I'm sorry, go ahead.
Oh, go ahead.
I want to point out that this vaccine is covered under vaccines for children.
Yes.
And vaccines for children is in every state in the country.
Right.
They all have a VFC program, and both the ACWY and the MEN-B vaccine is currently covered under that program. The pentavalent vaccine, as soon as they fine tune, it may be harder to find still until they fine tune how they're going to recommend it. You may get lucky and find it in a VFC program, but right now, they're still waiting, I'm guessing, for more specific direction as to how to use it.
Thank you for addressing that question. We also had a comment that someone said the College of Idaho does require both types of meningitis vaccines for students going in. I do want to point out the College of Idaho is private. And again, as you talk advocacy, we are seeing things come down that are going to be preventing vaccine requirements or recommendations for students going into private or public universities. So
that's great.
Fabulous.
That's great.
Yeah, actually, we do have that college on our website.
Yep. Yeah, but we are seeing more of those, the ability of even private colleges to make those recommendations or
Yes.
requirements are going down here in Idaho. So again, that advocacy portion that you talked about is so important. So.
Right.
Yes.
And if we can help in any way to help get either a strong recommendation for MEN-B or the pentavalent, or an actual requirement, we'd be more than happy to come in person and speak with whoever you would like us to.
Thank you so much. I'm going to really quickly have Mari Cruz. She's going to drop a link in the chat that is for our next webinar, similar to this one. That's going to be in March. So if anyone would like to make sure that you're registered for that, we're going to put that in there. We can also drop your link into the chat if you would like for your organization. So I'll have Mari do that really quick, looking up your organization and drop it in there.
And our email.
Oh, perfect. Yes, right there.
Sydney, if you want to pop that in, that would be great.
Yes, I so appreciate both of you for being here and talking to us. I'm curious about that visual about the student. It's had the children or the stick figures walking on the road and showing when each vaccine is due. Is that available on your website?
It is, isn't it?
Yeah, I think we have that as a graphic. I'm not 100% sure, Sydney.
Yes, it's on our website.
Okay.
Yep, it's on the website, but the posters, there's a poster specific to that one, which is probably the most effective.
Yes,
But we
of
could
course.
always resize for like a social media graphic if you were interested.
Mhm.
Perfect, yes, and that's a great point too, again, with that Adolescent Vaccine Week coming up, using those social media platform and your resources there is a great time to really highlight the need. I was shocked with the 80% of parents not knowing about the meningitis B vaccine.
Right.
So
Mhm.
that's pretty astounding statistic to not know that's available. And as you shared with your stories, how you didn't know that was, wasn't available, or, you didn't
Yeah.
know. So
Yeah, and we we go into detail about our stories, not like as a scare tactic or anything, but we want you to understand what our girls went through.
Yeah.
They went through so much. I mean, we live with the aftermath of it, but they were really sick. They suffered. They really suffered.
yeah,
So that's
It-
why we give the whole clinical picture of what
Mhm.
really happened.
it really gives quite an accurate depiction of what it's like, especially
Yeah.
since it is so quick.
Yeah.
So quick.
So quick when you're healthy. I mean, of course, if you are immunocompromised, you're really in a lot of trouble.
Yeah.
These are healthy individuals. We're healthy individuals. Yeah.
Well, thank you. I don't see any more questions in the chat or in the Q&A. So I just want to thank you both again so much for sharing your story and providing this education to those of us here in Idaho, and appreciate your amazing work in helping protect, our community and really sharing that word out there. So thank
Thank
you.
you. Thank you for having us.
Thank you.
Have a good day.
With that, we'll be ending the presentation and we'll be closing this down. Thank you everyone for joining us. Have a wonderful day.